prayer.
Yes,
Okay,
sir.
when I will tell you start.
Okay.
And after that, all the programs are scheduled. So good morning, everybody. Now I am requesting Madam Ishita Chatterjee to start the prayer, invocation prayer.
Om Sahana Bhavatu Sahano Bhunatu Sahabiryankarvavahai Tejasvinabadhitamastu Ma Vidvishavahai. Om Shanti Shanti Shanti. Thank you.
Thank you, Madam Ishita Chatterjee. Madam Ishita Chatterjee is academic assistant of our course, that is applied psychometrics.
Thank you, sir.
And now it is welcome address. So I welcome you all to today's panel discussion on forensic psychology. You may think that is why RPRIT, Ravindric Psychotherapy Research Institute Trust, is interested in forensic psychology. RPRIT is following the postulates of Ravindric psychotherapy. The Ravindric psychotherapy that is based upon the different postulates extracted from Rabindra Sangeet. So Rabindra Sangeet is composed by Rabindranath Tagore. And when we study the literary works of Rabindranath Tagore, we have observed that in different dance drama, in different poems, in different short stories, Rabindranath Tagore had given special importance on two aspects. One is the why people become criminal, and what are the problems of the victims. So two issues are very important in forensic psychology. When we study the Valmiki Pratibha, we have noticed that is how the culture, how the social demography lead people to be criminal, and how we can change the criminal personality to the personality of wisdom. And when we study Rabindranath Tagore's Bigha Jomi, so 2 bighas land, we have observed the pain of victims. When we studied Ajato Shatru, again we have observed the pain of the victims. So therefore, Ravindric Psychotherapy Research Institute Trust has thought of forensic psychology. So as president, when I am searching here and there, any professor who can guide me in designing the course, suddenly I met Professor Priyanka Kakar. It is just the God's gift. It's a gift from the God or gift from Rabindranath Tagore. I requested her, Madam, please you provide one course so that RPRIT can start it in the virtual mode. And Madam immediately gave me the course contents, and RPRIT has started the journey. The journey is not very smooth. It has a lot of the troubles. One major reason is that people are very much conditioned with the traditional system. So people are thinking about many things, but somehow with the support of my favorite student, Miss Meghmala Mukherjee, we have started the first course. And we are very much happy to say that one assistant professor of Bangladesh, she joined our institute. Recently, she has received the course completion certificate also. And I am very much fortunate to say that she tried hard to establish forensic psychology course in Bangladesh. So definitely it is our grand achievement. So today, we welcome you all to the panel discussion of forensic psychology. I hope that this panel discussion will provide you maximum awareness. One second. Ishita, join karo. দিলাম যে লিংকটা তোমাকে, দাঁড়াও আবার দেখছি, one second. শুরু হয়ে গেছে। আচ্ছা, So thank you everybody. Thank you everybody. So today we are going to start the panel discussion. So now I am requesting Anupama to say few words about our institute. Anupama Mukherjee, she is the virtual academic course coordinator. So I am requesting Anupama Mukherjee to say few words. Anupama, are you here?
Yes, sir.
Please,
sir, will you please allow me to share the screen? I have a PPT with me. Kindly allow me to share the screen.
Yes, now you can
Yes,
show. Thank you.
Okay, thank you, sir. So I hope I'm audible as well as visible on the PowerPoint.
Yeah, you are audible and visible. Thank you.
Anindita, please mute yourself. So, as we know, as sir told, that Rabindrick Psychotherapy Research Institute Trust has begun its humble journey on 1st July 2018. During these last 4 years, the trust established itself as a premier institute to propagate the vision of Rabindranath Tagore and the postulates of Rabindrick psychotherapy through virtual network system. Since it is a research-led, future-oriented school of psychology, we are focused on developing a new generation of social scientists and research scholars in the approaching future. Currently, this institute has more than 100 certified students. The motto of the institute is to disseminate and create knowledge through short-term and long-term academic courses, internships, micro-internships, seminars, webinars, and workshops. Students are trained here under the guidance of qualified internal and external visiting faculties, including a lot of professors, associate professors, and assistant professors. In fact, the Academic Council of Rabindrick Psychotherapy Research Institute Trust also plays a critical role in management of these academic activities and researches. In fact, we will be having Dr. Ishita Chatterjee, our Academic Council member today also as a part of our, as an evaluator of the current panel discussion on forensic psychology. As Sir told, that Rabindrick psychotherapy refers to the way of self-awakening through the use of therapeutic postulates, which is extracted from the literary works of Rabindranath Tagore. So other than the introduction and expansion of this concept and its applications and catering it to the laymen who are not quite aware about this mode of psychotherapy, the research trust also follows a systematized, organized approach in the development of research skills of undergraduate and postgraduate students. All the course classes are held online using Zoom platform and Google Classroom, while the examinations are conducted at a regular basis under the supervision of Core Examination Committee. In fact, I would like to highlight over here that we're undergoing the process of formulation of training manuals. We have already started one for the applied psychometrics course so that the curriculum and content is easily accessible to the student fraternity. RPRIT has also conducted more than 70 workshops, including research methodology, data analysis through R programming. The one you can see here was specially designed for children, and it was facilitated to the school students, as you can see, the Good Shepherd School, Kharda, and regression statistics on school psychology. Recently, we have also launched, in fact, Sir has totally designed it and successfully trained and around 30 students in a 1-hour based 5-day-long workshop on SPSS, which is considered to be a very important tool for conducting the research. Furthermore, this last weekend, 30th May and 31st May, we had a special workshop on life skills for prevention and management of addiction in collaboration with Swabhivik Foundation, which is a de-addiction and psychotic disorder patients counseling and rehabilitation center. Furthermore, Sir has also launched a newer course called especially on MS Excel, highlighting its specific features like revenue theory, pivot table, how to visualize the data and how to use a dashboard, how to present a report using advanced MS Excel features. We have a lot of ongoing skill development courses like story therapy, Rabindra Nitya, Kathak, then drawing therapy, dance therapy, Ravindric story therapy for conflict management, educational dance for children, positive emotions, environmental psychology. Other than this, we also have a special session called National Sunday Webinar Program organized by Sir. As you can see, for example, the folk architecture was one of the topics over here. And also there was another one, which was reflective consciousness. This was also a free national webinar to all, accessible to everyone without any kind of payment mode involved. We also conduct national symposia every 2 months to facilitate our students in order to gather more exposure to the current ongoing research trends in various domains of psychology. In fact, lastly, we had a national symposium where Dr. Priyanka ma'am was also involved, where we gave Masuma the certificate of completion of the Forensic Psychology L1 course. Furthermore, we have also hold up invited lectures in collaboration with Ramakrishna Mission Vivekananda Centenary College, Rahura, where Swami Kamalasthananda gave a special lecture on Chetana Shondhani Swami Vivekananda, or rather in search of the enlightenment of our consciousness by Swami Vivekananda. Furthermore, we have also launched career counseling skills, which caters to specifically to the domain of teacher trainees. The guidance and counseling is a skill that permits the educator to communicate and counsel a heterogeneous group of students based on their individual requirements. So this is how we are building up on everywhere. In fact, we have recently launched an online counseling session on the B.Ed curriculum in collaboration with Adamus University, with whom we are actually building up more, courses and everything, so that we can facilitate a greater cohort of the B.Ed and M.Ed trainees, teacher trainees. This is something we're really looking forward to. And finally, we have launched a very recent course of applied psychometrics, where you can see Ms. Ishani Chakraborty and Anindita as academic assistants. Anindita was previously our student in the last applied psychometrics course, which was taken care of by Anushri Bose and Rosemal Thambi. So this is where we can say that RPRIT has its own facility of placement assistance, whereby at the end of each course or internship, the most qualified students are allowed to be interviewed by our prestigious selection committee for the facilitation of a revamped innovative course. And this is how we are helping students to develop their organizational skills, digital teaching and management skills, soft skills, accounting skills, and so on. So lastly, this is our sir, our founder president, Dr. Debdulal Dr. Rai, without whom nothing could have been possible here. He is the one who is actually helping us pave the way. And it is a learning experience throughout every time we sit with him and talk about discussions, and we hold all this. So thank you so much, sir, for giving the opportunity to present the academic achievements of RPRIT as of till now. So I would like you to take over now. Thank you so much.
Thank you, Ms. Anupama Mukherjee. Very nicely you have covered the academic achievements of Ravindric Psychotherapy Research Institute Trust. I think this is very, very important, because today we have the panel discussion and our esteemed professors are with us, and some of the panelists, they are also with us, so they must be aware of it. So now I am requesting Meghmala to introduce our invited guest.
Hello, am I audible?
Yeah, you are audible.
So, good morning to everyone present here. I welcome you all to this panel discussion on forensic psychology. It is my honor to introduce the guest to all of you. I would like to welcome Dr. Priyanka Kakar ma'am. We are honored to invite you, ma'am, for being our guest. Dr. Priyanka Kakar is a Senior Research Assistant Professor of National Forensic Sciences University, Galvanic since 2013. She is teaching and carrying out research in neuropsychology and forensic psychology. She has been published in over 60 international and national journals. She has also received several awards for her excellent activities in forensic psychology field. I would like to request you, ma'am, to say a few words. Priyanka, ma'am.
Yes, Meghmala, thank you. Thank you, sir, for inviting me for this panel discussion. It's always a pleasure to be part of RPRIT. And I wish that in your hunt for getting assistants for running all these courses, you will get best students and best faculties. So I am here to support the institute in whatever manner I can. And I wish all of you a very best and very prosperous future in association with RBIT. Thank you, sir. Thank you, Meghmala.
Thank you, ma'am. Thank you for your kind words. Now, I would like to welcome Dr. Ishita Chatterjee, ma'am. Also, we are honored to invite you, ma'am, for being our guest. Dr. Ishita Chatterjee is an associate professor in the Department of Applied Psychology of the University of Calcutta. She has completed several projects successfully, which include stress, coping, suicidal thoughts, process, and meaning in life of college students. She has been published more than 50 international and national publications. Now, I would like to welcome you, ma'am, and say a few words.
A very good morning to all of you, and my heartfelt thanks to Sir because of his different new ideas in field of Rabindric psychotherapy and in Rabindric Institute of Research also, and his contribution to the society. And Rabindric Institute is doing, RPTI is doing best, and I think it will do more for the society, for the students. I wish all the best to the panelists today, and think that they will get a chance, an opportunity to learn. Thank you.
Thank you, ma'am, for your words. I would like to mention also Dr. Ishita Chatterjee, ma'am, also the Academic Council member of RPRIT. So, now I would like to request Devdulal sir.
Thank you, Professor Priyanka Kakar, Madam, and thank you, Professor Ishita Chatterjee, for your nice coverage and your support to Ravindric Psychotherapy Research Institute Trust. So, Meghmala, whether all the panelists are ready?
It seems they are online and
Just you check. I think Shaptapurni is here, Ruchika is here. Any other person?
Chandri isn't here, but some people are joining in another different name. So, Chandri, it would be better if you give one kind of attendance.
Another thing that is we can request Priya Bharma to say a few words about the job responsibilities
Yes.
and the functional aspects of the virtual academic assistant. She has very good experience. She has covered our applied psychometry course, and currently she is managing 2 courses. So now I am requesting Priya. Hello, Priya. Please you update about.
Yes, sir. So good morning, everyone. I wanted to talk about the two courses which we are running from RPRIT. First is 3 months questionnaire construction internship on personal selection. So this internship is aimed at designing a questionnaire, and the questionnaire on the three variables: adaptability, achievement, motivation, and integrity and honesty, aimed for selection of personnel for a microfinance company. So the entire internship would be aimed at developing a questionnaire from scratch, and the interns would be learning all the nitty-gritties of developing a questionnaire from starting from literature review, qualitative analysis, item domains, and then final content validation, test standardization, pilot testing, and the testing on the final sample, and then designing norms. So the entire process would be covered in detail. So far, we have completed a month in the training, and the interns are not only getting the theoretical aspects behind every step, but also getting practically trained by. So Kavita, Shaj, and I are taking care of this internship. So this is about the questionnaire construction internship. The second internship, which we are about to start, is about the test adaptation. So that internship would be launched soon, and it is a stipend based internship, and that internship is based on the test adaptation on different languages. So it would include test retest reliability and the statistics involved while adapting the English test into Hindi and Bengali. So that test would be able to cater the needs for different languages. So this is about the two internships. Thank you, sir.
Thank you, Pia. Now I am requesting Meghmala to say a few words about the forensic psychology course.
Yes, sir. So, RPRIT has successfully completed 2 batches of the forensic psychology for the level 1 course, and the course basically covered in such way, which is like giving the brief discussion about the topic forensic psychology and completing a research orientation also, where we are trying to teach the basic of research methodology and the assessment we can use for forensic psychology field, and the theories behind criminal behavior and victims. And that's it, sir.
Thank you, Meghmala. I think Ashma is Ashma here?
Yes.
Forensic psychology 2. Meghmala, whether Ashma is here?
Yeah, Ashma is there, sir.
Ashma Jahan, am I right?
Yes.
Ashma Jahan. Hello, Ashma Jahan, are you here? So please unmute yourself. I think she has some technical problem. I do not know. Okay. So can we start now the program? Meghmala? Or?
Yes, sir, we can, but I don't think Chandri is there.
Okay.
There are some participants with different names. So, Chandri, if you're there, please just unmute yourself, please.
Is Chandri here? I do not find Chandri.
Yeah, that's why. There are some participants with different names. That's why I'm saying.
Oh, Redmi, is it Redmi Chandri? I have no idea. I've requested all of them to follow the registered name. Okay, there are some professors here. So before that, we can request them to say few words about their current activities and about their idea about the forensic psychology. Professor Ma'am Shamin, she is from Sri Lanka. Thank you, sir. You are here.
Yes, sir. Yes, sir. Good morning, sir. Good morning,
Good
everyone.
morning, sir. Good morning. We are very much fortunate you are with us. Thank you.
Okay, sir. Welcome, sir. Thank you.
Yeah, now we are following a lot of the activities in Sri Lanka. So
Yes.
if you have anything to say, something about the current condition of the Sri Lanka, and is there any, and what are the, because today will be the panel discussion on forensic psychology. If you have anything to say, you can share.
Right. Okay, sir. Now with the present condition, Sri Lankan economic and other condition, political unstable condition, really, it made a lot of, psychological and, impact on the people. So regarding this forensic, really, it's I am not I'm a psychologist. I'm an educational psychologist, and so really I would like to learn more about more knowledge about this forensic one. That's why I'm here. Thank you so much for organizing such the free seminars and workshops. Yes, sir. I must thank you on behalf of all these participants. Thank you, sir.
Thank you, Professor. Very true. That is our criminal behavior, our delinquent behavior. Sometimes the determinants are the economic crisis and the political instability. So thank you, Professor. Dr. Jerina Begum, she is from Meghalaya. So ISTM is very famous place. Recently I visited ISTM and Madam has arranged my lecture there on R programming. So Madam, thank you for joining. Do you like to share something?
Yes, sir. First of all, I would like to thank you. We are very much grateful to you because under our print, you are arranging lots of new area, new things and new topic for our students. And regarding forensic psychology, actually psychology subject, it is still here, it is virgin stage. Little bit scope is there, and also the psychology subjects also very few in our area, Northeast region, and there is no clear criminal psychology as a subject or course in Northeast India. So we are very much grateful. Our students also very much keen to know about this. So they are joining also. They waited to learn about the clinical psychology. We are very much grateful to you, sir. Thank you, sir.
Thank you, madam. I have visited Northeast several times. I did a lot of the research on the tribal problems, tribal issues of the Northeast, and during the insurgency period, I worked in Manipur, I worked in Meghalaya, I worked in Tripura, I worked in other places. Okay, and little bit area about the this Nagaland also. Okay, so I have observed, that is, what are the factors, what are the socio-demographic factors are contributing particularly for the development of delinquents activities. And I am very much hopeful that we can change the socio-demographic condition of the northeastern states of India if we find many students from your place to RPRIT, because RPRIT is providing virtual academic course, and that is the state free. It is the vision of Rabindranath Tagore. Okay, so it is totally universal in nature. Anyone can join from any part of this world. Thank you, madam. So now I am requesting Meghmala.
Yes,
What
sir.
is the any update about the?
Chandri, if you're there, please unmute yourself. Chandri Roy.
Is she here? I do not know.
Sir, if I may, I think we should go ahead with the next panelist, if she is available. What do
I
you say,
think that is
Meghmala?
better. We can start it
Yes.
as quick as possible. Huh?
Yes.
So,
Our second panelist, Nikita Tanpure, also won't be able to present. So the third panelist is Priya Kaushal.
Priya Kaushal, okay, Priya Kaushal sent one drive, but I do not find the drive is not working. So I do not know how I can present her paper. I am trying repeatedly, but I am not getting. So who is the next?
Our fourth panelist is Ruchika Gupta.
So Ruchika is here. Hello, Ruchika. Good morning. Hello, Ruchika. Good morning.
Good morning, sir.
So
I'm
you
here.
will get more time, not the 10 minutes. You can get 15 minutes or 20 minutes. No problem. You can continue. And many
All right, sir.
are here, professors are here. So they will try to understand from you what is forensic psychology and your approach. Thank you, Ruchika.
Okay, so I'll be sharing the screen, sir. Please respond if you are able to see the screen, okay?
Yes, you can share the screen.
Just a minute.
In the meantime, I would like to share Ruchika is going to present on psychological scaling in forensic psychology, and she's pursuing MSc in forensic psychology from National Forensic Sciences University right now.
Is my screen visible?
Yeah.
So good morning, everyone. My name is Ruchika Gupta, and I'm pursuing MSc in Forensic Psychology from National Forensic Sciences University, Gandhinagar. So today I'll be covering the topic, the psychological scaling in forensic psychology. Before moving ahead with the relevant scales which are prevalent in the field of forensic psychology, we'll be discussing about the scaling part. So what is scaling? Scaling is basically the quantification of the psychological attributes. Attributes and events like sensations and perceptions. It can also be called a technique to quantify relation between the stimulus traits and the perceived magnitude. In the field of scaling, there is the placement of available responses at a location where expression to a stimulus can be put in a certain degree or on a continent. From day-to-day life, we see scaling of different types in different arenas. For example, you might have filled certain feedback forms or maybe questionnaires where you might have seen a quantum varying from one extreme end to another. Those are different types of scalings. For example, in usual forensic settings or clinical assessment of psychological equipment training, we see many scaling techniques like Likert scale or continuous scaling, etc. In the field of psychology, the scaling is an entirely a field that defines a class of instruments which helps in the evaluation of variables and concepts. Scalings are also termed as rating scales. These rating scales are used to measure variables and functions, including cognition, social, emotional, and behavioral aspects. Further, we have the scales of measurement. So the data that we collect, we put into the quantifiable terms on a continuum or scale can be categorized into 4 different types: nominal, ordinal, ratio, and interval. So these four types of scaling of measurement techniques share many aspects and characteristics apart from the distinguished characteristics, of course. So first we have the nominal scale. In the nominal scale, the data is being put into certain categories and labels. These labels or categories do not have any magnitude or any mathematical value as such. Second is the ordinal scale. In the ordinal scale, the data is being put into certain ranks and orders. For example, let's say we are having a swimming competition. After the swimming competition ends, there are the winners at the first, second, and the third ranks. So the first, second, and third are the ranks and the categories in which the participants who have won these ranks are being put. But there is no magnitude or mathematical value which could be quantified between the first or the second position or the second or the third position. Those are simply the orders where the participants are being ranked on the basis of their positions, right? Next, we have the interval scales. In the interval scales, we have the variables and attributes which are put at certain intervals, and those intervals are of equal units. Fourth is the ratio scale. Well, interval scale and ratio scales both use certain mathematical aspects and have magnitude. But what distinguishes these two types of scales of measurement from each other is that the ratio scale has the unique quality of including the absolute zero. Further, we have the techniques of scaling. The techniques of scaling are of two types: comparative scaling and non-comparative scaling. Comparative scaling, just please give me a minute. So the comparative scaling is a technique where direct comparison takes place. For example, an individual is being asked for his or her preference to Fanta or a Coke. So here, even the slightest difference between the stimuli can be measured, because as we can see from the example that only a limited amount of responses are available to the individual. So it applies that there is no factor of generalizing beyond the stimulus in hand. For example, in stimulus in hand, we have Fanta and Coke, but we can't generalize the answer to these two stimulus to another categories, let's say Pepsi or Miranda. Next, we have the types of comparative scales. There are four types of comparative scales: paired comparison, rank order comparison, constant sum, and Q-sort. Paired comparison is where stimuli are given such that they are being paired, and the individual is to decide which one they would prefer more to have. And the pairs could be in form of n into n minus 1 by 2 forms, and these many types of pairs could be formed of the attributes or the variables that are being presented to the individual. Second is the rank order comparison. In the rank order comparison, several items are being present simultaneously and is being asked by the individual to be ranked or ordered in accordance to the preference of an individual. For example, we give an individual 5 items, let's say a bottle, a pen, a sharpener, and a phone. So the individual would be asked in order of the preference to rank these 4 to 5 items. Then we have the constant sum. In the constant sum scaling, a constant amount of units is being allocated to users, which they are to be distributed amongst the stimulus available. It is generally used for product marketing so as to know for which product the person is willing to spend more. Next, we have the Q-sort technique. The Q-sort technique is used to discriminate between the large number of stimuli. It follows the technique of rank order. Since the data here is piled up according to the similarity to a particular criteria in hand. Next, we have the non-comparative scaling. Non-comparative scaling are the ones where the attributes or the data given is being analyzed on different independent parameters. Here, respondents are free to place items on the provided continuum according to their liking. Here, the most of the data input involves the inclusion of the interval scales that we have read before in the previous slide. So the first type of non-comparative scaling is the continuous scaling. The continuous scaling is a degree of ratings between two extreme ends. As we can see in the image that we have two ends, excellent and worst. Although they can tell you that these are two opposite adjectives, in the continuous scaling, it is not necessary that we get the exact opposite endings, but or adjectives, but what we can see is the individual is being provided an opportunity on the continuum to place the value or the, let's say, the quality of A in certain degree. Let's say this one is 1, 2, 3, 4, and till 6. Here, the individual is rating the quality of the product, let's say A, as 2.2. This is the example of continuous scaling. Next, we will move forward for the non-continuous scaling. So there are 4 types of non-continuous scaling in hand. That is Likert scale, semantic differential scale, staple scale, and graphical scale. Graphical scale is the most usually seen type of scale that there is. For example, you go to a restaurant and after you are being done with your food, you are being given a feedback form where you are being given certain emoticons, right? So as to rate your response, where where do you find yourself when it comes to being satisfied. Here is the example of one of the graphical scale. For example, I gave this example of being in a restaurant and providing your feedback for the food that you just had. You will be provided with a feedback form where these 5 emoticons would be given. So you can say there is this graphical representation of the attributes that we are trying to degree of attribute that we are trying to measure. The attribute is that of satisfaction, and we are trying to measure if the person or the individual or our customer is satisfied or is not. So this is a 5-pointer scale here. This is the example of graphical scale. Next, we have the Likert scale. A Likert scale is a 5 to 7-pointer rating scale, which may vary from strongly disagree, neutral, agree, strongly agree. This is one example of Likert scale. It is popularly used to measure attitudes. Next, we have the semantic differential scale. Well, semantic differential scale are the rating scale with bipolar adjectives. I'll give you the example of it. Just a minute. Yes. So here we can see, this is the example of semantic differential scale. We have 2 adjectives on 2 extreme ends, that is rude or courteous, and there are various degrees in between which lies on the continuum, and the individual is being asked to provide his or her response on the same. Next, we have the staple scale. Staple scale is being used as a substitute to the semantic differential scale when we do not have 2 opposing adjectives, such that we have only the availability of one adjective. That is, it is a unipolar rating scale. So here we have the example of staple scale as well. As we can see, the attribute here is innovative. So the individual is being provided with an entire continuum varying from +5 to -5. The +5, that is one extreme end, is described as where the attribute is being described as describes very well. -5 is for poorly describes. So it is upon the individual or the subject who is being provided with this scale now, where the individual decides to mark his or her response to the factor of innovation. Let's say in this example, the innovation in case of Samsung mobiles. So this was about the non-continuous scaling. Okay. Next, we have the assessments which are relevant in the field of forensic psychology. First, we can here see are available the Rorschach in-block test, TAT, Zondai test, MMPI-2, and Million clinical multi-axis inventory. You might be aware of these 4 tests though, which are Rorschach, TAT, MMPI, and MCMI. But let me tell you about the Zondai test. Zondai test is one of the unpopular but most interesting projective test there is. Here in the Zondai test, the individual is being provided with certain images of people with mental illness, where they are being asked whether they would prefer this image or they won't. So they have 2 options, to reject or to accept. So it is in line with the theories and the concept of psychoanalysis that is being provided by Freud, which talks about the untalked about, or maybe the hidden drives and motivations of an individual, which could be projected using projective techniques in the psychological assessment. So it is example of the same. Next, we have the cognition and intellect. So Wechsler, here we have the Wechsler adult intelligence scale and trail making tests A and B. For specific forensic judgments, we have 4 scales here: sexual violence risk, psychopathy checklist, which is the here psychopathy checklist, which you might be aware of. Then we have juvenile sex offender assessment protocol, in short being called JSO. Then we have risk for sexual violence protocol, that is RSVP. Also, we have other assessment tools. For example, risk assessment tools could be the Statistic 2002, Statistic 99, which studies the offender's history as the indicator of risk. Then we have violence risk appraisal guide, and for malingering purposes, we can use 2 most prevalent assessments, which are structured interview of reported symptoms, that is SIRS, and test of memory malingering, that is TOM. So further, we'll be discussing few of the relevant scales in forensic psychology, which most of the psychologists, or let's say professionals usually prefer to use. As we can see on the screen, we know that although research and theoretical framework in the field of forensic psychology is built up around a variety of scales and measurements, practically there remains just a few instruments and measures that are the go-to tools for most of the psychologists. Let's say either those psychologists are new or old in this field. We have certain relevant terminologies which are of utmost importance when we talk about the scales in the field of forensic psychology. These relevant terminologies are competence to stand trial, that is CST, MSO, that is mental state at the time of alleged offense, that is the mental state of the offender or the individual in hand. Then we have FMHA, that is forensic mental health assessment. So the techniques and the assessments that we use in the forensic settings in order to assess the mental health of the client are the part of FMHA. So basically FMHA is a broad umbrella where the forensic psychologists are the professionals who carry out the assessments or the inventories part. Then we have the FRI, that is forensically relevant instruments, and FAI, forensic assessment instruments. So these are the 2 categories where most of the assessments lie. Like FRIs stand for forensically relevant instruments. These are the instruments which measure the clinical construct related to the legal issue. But when we talk about the FAI, that is forensic assessment instruments, these are the instruments which directly measure the legal construct. So like I said, when we are talking about FRI, that is forensically relevant instruments, These are the clinical constructs related to the legal issues, such as response style and psychopathy. Then we have forensic assessment instruments, which directly measures the legal constructs, such as functional ability related to the adjudicative competence of the individual. So when we talk about the forensic field of forensic psychology, the assessments or the techniques that we use here can be divided into FRI and FAI, forensically relevant instrument and forensic assessment instruments. Like I said, forensic assessment instruments are directly related to the legal constructs, and FRIs are FRIs are indirectly related to the legal constructs, and FAIs are the are in direct relation to the legal constructs. So here we have the distinguishing assessments for FRI and FAI. In FRI stands the MMPI-2, PCLR, SIRS, that is the structure interview of reported symptoms, test of memory malingering, Pclr Scale, Rorschach ink-block test, and TAT. For FAI, we have the Mcarthur competency assessment tool, juvenile sex offender assessment protocol, risk for official violence protocol, statistic 2002, statistics 99, and violence risk appraisal guides. Apart from these assessments, there are various assessments that are available for the forensic psychological assessment part, but these are the ones which are prevalent in the field at the current times. So we'll be discussing a couple of them. For example, let's say MMPI-2. So MMPI-2, as you all know, is a test for testing the adult personality and psychopathy. It assists in developing treatment plans, differential diagnosis for various legal answerings, and for personnel selections. It first came out in the year 1943. It has various constructed scales to improve its interpretability, which has been going on since 1943 till the current times. In the MMPI-2 questionnaire, we have 338 questions, which takes about 35 to 50 minutes to complete. These questions are in form of true and false. There are various scales that are the MMPI contains, and various scales where I'll be telling you a couple of them, which includes the hypochondriasis, depression, psychopathy, paranoia, schizophrenia, social introversion, etc. Next, we have the PCLR scale. PCLR is the revised Ayres psychopathic checklist. It is a 22 items checklist where each item reflects a different symptom or characteristic of psychopathy. It is a 3-point rating scale that is ranging from 0 to 2. 0 means that item doesn't apply. For example, for one statement, we have 3 responses, that is 0, 1, and 2. 0 signifies item doesn't apply. 1 signifies item applies somewhat, and 2 implies item definitely applies. Here we can see from a very slight observation that this scale that we are using here in the PCLR is slightly unbalanced, as the respondent's answer is to be bent towards either choosing 1 or 2. Like when we say yes and no, there is equal probability of given to the individual that he can choose either yes or no. Yes on a positive note, no on a negative note. So here we have 3 items, right? 0, 1, and 2, where we have doesn't apply, somewhat applies, and definitely applies. So as you can see, the application part is being more stressed upon. So there are chances that the individual might check on the item applies somewhat option. So that is a point of discussion for a different time though, but we'll carry on with debriefing about certain skills that are being mentioned here. So like we were talking about PCLR. PCLR items are based on current functioning as well as the lifetime functioning of the individual. It includes scales like shallow effect, lack of remorse, guilt, parasitic life, pathological lying, impulsivity, irresponsibility, criminal versatility, etc. Next, we'll be discussing a couple of scales for FAI, that is Forensic Assessment Inventory. First is the Mcarthur Competence Assessment Tool, which in short can be called MCAT-T. It assesses a patient's competence to consent to treatment. Here, capacity to consent is being measured. Capacity to consent means that if the individual has the ability to use and understand the information to make an informed decision and be able to communicate about the same. It is a semi-structured interview which is being tailored to the patient's or the offender's specific disorder and treatment decision. Next, we have the Juvenile Sex Offender Assessment Protocol. This is basically a risk assessment tool used to design to be used with the boys in the age range of 12 to 18 who have been adjudicated for sexual offenses, as well as non-adjudicated youths with a history of sexually coercive behavior. Next, we have the Violence Risk Appraisal Guide. It is an actuarial instrument. An actuarial risk assessment instrument is a statistical method of estimating the risk of a particular event's occurrence. In this case, the particular event is the sexual offense risk. So it is an actuarial instrument that assesses the risk of further violence among men or women who have already committed criminal offense. It is a 12-item instrument assessing risk of violent recidivism. When scoring the Violence Risk Appraisal Guide for research and individual assessment, it is required to study the comprehensive psychosocial history, addressing the childhood conduct, family background, antisocial and criminal behavior, psychological problems, as well as the specific details of the offenses and the offender. Last, we have the Statistic 99 and Statistics 2002, which are also actuarial instruments that predict sex offender recidivism. It categorizes the distinct risk levels such as low, moderate, and high risk to reoffend by the individual. So given that we had the limited time, I had only given it the amount of information that could be provided in that 10 minutes interval. So I hope it was fairly informative for you all, and it could be further discussed upon in the question and answers round. So that is all on my side. Thank you for all.
Thank you, Ruchika. Very nicely you have covered some of the important scales used in forensic psychology. You have covered many psychological tests. You have mentioned MMPI-2. I think there is another, the version is that is MMPI-2-RF. Do you have any idea?
Yes, sir.
So MMPI-2 is better or MMPI-2-RF, which will be the better for the specifically in handling the this forensic psychological case?
Sir, it depends on the individual profiles. For example, we could have individuals who are who are pathological liars. So okay, MMPI-2 is I think MMPI-2 is a test, or it's a test basically which could be used in combination to other tests in hand, and only using it through the combination of other scales and techniques we can identify which one is more relevant for the case given in hand.
Okay. Now, usually in case of the validity assessment in any psychological test,
yes, sir,
we are following the model that is the correlating the original test score with the other dependent variable. But MMPI-2-RF or MMPI-2 also, it has a different models of validity. So can you explain?
So there are different models of validity. Like you said, there are different validity scales in MMPI. These validity scales could be CNS, Vin, and Trin, these are actually present to exaggerate or to find out the prevalence or the detection of several psychological symptoms which are present in the scales given in the MMPI-2 questionnaire for a particular individual. So at the moment, I can't recall the exact
Okay,
functions of
I
these
understand. I
validity
understand,
scales, but
Ruchika. I am
yes,
sharing that is MMPI-2 RF
yes, sir.
follows the model of validity that indicates whether my statement is valid or not.
Mhm.
So it is not the validity with another test. It is the validation of whether my statement is valid. So suppose I am the offender, okay, so I can manipulate my statement, but MMPI-2 RF can give me this information, that is whether I have manipulated my statement or not. So this is the model MMPI-2 RF is following. So, Acha Ruchika,
Yes.
what type of psychological scaling is there in case of the MMPI-2?
Sir, like I said, MMPI-2 includes the true and false statements. So either the individual can choose true or false for the given statement if that statement validates the kind of characteristics that individual hold. So it could be called as comparative scaling, where only two options is being provided for the individual to respond with.
It is a comparative scale, or it's a nominal scale, it's a binomial response?
So it's a binomial response, but like I said, it could be placed in the category of comparison scales since only two, since like you said, the only binomial response is available for the individual to respond with, that is true or false. So it is binomial, and it could be placed under the category of comparison.
Okay, now you have told about the Rorschach test also.
Yes, sir.
How does Rorschach can help us? Because Rorschach is usually for the clinical diagnosis, so suffering from schizophrenia, MDP, hysteria, like that. So how Rorschach test can help us in case of the forensic psychology?
So I'll try to explain it in brief though. But when we talk about offenders and criminals, and when we talk about interrogating them about the offense that they have like the offense that they have perpetrated, there are many offenders who would not actually tell about the details in the exact order of their occurrence. And that is the reason that we use many forensic psychological assessment tools in combination, so that we can phase out who are the offenders who require an intense interrogation and who are the offenders who do not require as much of intense interrogation. So when we talk about Rorschach ink blot test, it performs the function where the scoring and the administration of this Rorschach test is able to tell the technician or maybe the clinician who is carrying out the test about the hidden motives and the intentional drives of the individual, which he or she is not otherwise willing to tell to the investigator. So this is the main criteria where we can administer the Rorschach in the forensic psychological assessment, so as to know the drives and the hidden motives of that individual that he or she is not willing to tell at the point of time. So it is not like that they will right away tell about the hidden uh, motives or the kind of statements or thinking pattern that they are holding. But at least through this projective technique of Rorschach ink blot test, we can carry out or we can get a direction whether the other statements that are being provided by the offender or the individual places correct in the direction or not. Like when we talk about the forensic psychological tools like polygraph or maybe LVA or brain fingerprinting, these are called to be the corroborative evidences in the court. That is, if they link directly in the direction of chain of evidences which are being followed previously, they will be considered. Otherwise, they will be a question in the arena of consideration. So it is of the same nature that when we talk about the Rorschach ink blot test, it is a projective techniques that will tell us about the hidden motive of an individual that there might be, so that further interrogation could be carried out accordingly. So does this answer?
Okay, Ruchika, have you administered any Rorschach test to obsessiveness to make the offense?
So
This
can you
type of
repeat the
patients
question?
obsessive, because there are some people, they are very much obsessive in nature to make the criminal activity.
Yes, sir.
So what will be the clinical features, or what will be the features with respect to the location, content, popularity, and the form level? Any idea?
So, sir, when we talk about Rorschach test, when we are scoring it, the scoring is based upon different aspects of the pictures that we are using. Like we know that these ink blot tests are symmetrical ones in nature, but where the individual focuses his or her attention is the part that we as the technicians focus on. Like the individual is focusing on the marked points, or the individual is focusing on the white background of the picture, or the individual is focusing upon a particular color in hand, or maybe the particular object that he or she can see but others can't see. So we present different sets of images of ink blots to the individual, we through a pattern of responses that the offender provides. We can say that if the individual is pointing or directing us towards a particular domain, or maybe a category where he or she is otherwise not talking about.
So Ruchika, whether you have followed the Cloffert's model or the Exner's model?
Sir, it's the Ekner's model that is
That
till
you have
date
followed.
followed.
Okay.
Yes, sir.
Okay, so if you follow the Cloffert's model, possibly you can explore many things more, of course, because a lot of the qualitative information that is also in the quality in this Cloffert's model. You can follow both. I think that is better, because specifically if you think about the obsessiveness, so they are giving importance on the minimum details, the maximum details. So the DD, in case of the location, DD will be higher. And in case of the form level, if they are very intelligent, automatically A+ will be higher. So you can think about it. That is a good idea. So
yes,
another last question that people are talking, that is in case of the legal proceedings. Okay.
Yes, sir.
It is always better to follow the non-psychological questionnaire. Rather, it is important to follow the some other, for example, the BOs and other techniques. So, is it possible? What is your opinion?
Sir, as I have mentioned in the slides, that there are various relevant terminologies that we need to know in case of the field of forensics and legal. Those are the CST, that is the competence to stand trial, MSO, mental state at the time of alleged offense. So, sir, these are the two statements which the legal proceedings and the law enforcement usually confide upon. That is, if the individual is competent enough to stand the trial, or what would be the mental status of the individual before, during, and after perpetrating an offense. So these two are the things that mainly law enforcement agencies stress upon. That is the reason that they do not usually include the forensic mental health assessments, and there is certain resistance. But coming to terms, when we talk about the risk assessment and basically the category of recidivism, it is of utmost importance that at least we need to know the criminal profile of that individual, so that we can deter that if the individual would what exactly is the history of that individual, what is the current functioning of that individual, and what are the risks that the individual uh, per- is willing to perpetrate in the society. For example, an offender is being incarcerated for let's say a particular offense, that is a sexual offense, but we do not know unless and until we administer certain mental health assessments on that individual, to in order to administer or to test his personality traits, his attitudes, his pathology in case of being a liar or malingering. Unless and until we administer such instruments, we wouldn't know if that individual uh, basically what is the capacity or what is the ability of that individual to commit further crimes, or to actually uh, give out certain behaviors and what can you say, attitudes which are self-deteriorating as well as deteriorating for the society as whole. So I think that answers the question, and if it doesn't, I'll try to brief it again, but in
No, no, Ruchika, you have properly mentioned. Actually, this is the forum for the awareness generation. So there are many people, they are from the clinical psychology background. So they like to know that is, I am from clinical psychology. I know schizophrenia, I know MDP, I know all the diagnosis features, I know everything. Why do I study the forensic psychology? Is it necessary to study? So what is the difference between clinical psychology and the forensic psychology, or whether their approach is same or different? Because when you are teaching of course the clinical features, and in clinical psychology students they are also learning the same thing. So your orientation, that is very much related to the legal proceedings, but except is there any other area that forensic psychology tends to explore? So that is the purpose. Okay, thank
sir,
you.
there is this experience I would like to share.
Sure,
If
sure.
the podium is open. Okay. So the last time I was interning at FSL, that is Forensic Science Laboratories. So there was this case in hand where the scientific officer of our division was, he asked the police officer, the IO, that what is the reason that we generally go for the third degree treatment, and we do not go for other styles of treatment for a offender or a suspect in hand. So there was this one answer by the IO that we are being given only 24 hours to present the offender or the suspect in front of the magistrate, and out of those 24 hours we have only 2 to 3 hours left for the exact interrogation to occur, right? So when we talk about just a couple of hours, so what can we expect from a police officer other than a third degree treatment, in order to take out the information which is relevant to the case? Like you said, sir, there are many questions in the field, that why clinical psychology or the psychological assessments are required in the field of law. So this is the basic answer, that there are many questionnaires and also there are many tests that are available that could be introduced as a part of interviewing or interrogation, and these tests or these questions are just 2 to 3 in number, which can be used just like that in interrogation, and it can offender is trying to point out, and the direction where the offender is trying to hide his motives and certain interpretations about the offense in hand. So when we talk about, like you said, this field is a wide umbrella which requires further advancements, and we are not even at level 0 here. We are moving in the negatives only here, where we many of us do not know what is the importance basically of psychological assessments in the field of law as well, because offenders could be like very diverse in their own characteristics of personality, in their characteristics of committing an offense. But these characteristics could be evaluated, could be measured only when psychologists come into the field of this law and law enforcement agencies. So that is what I wanted to include in what Devdalal sir said. So that is also, I hope it was relevant.
Yeah, Professor Jerina Begum, she has written that is orientation and application are very different from clinical psychology. It is important to learn the forensic psychology. That is, thank you, madam. Thank you. Thank you, Ruchika,
Thank you, sir.
for your nice elaboration. So, dear audience, if you have any question or anything to know, because you know that is specifically in the Eastern India, we have very limited knowledge about the forensic psychology. So if you have any question or anything to share, because the Ruchika is from National Forensic Science University. So whatever her knowledge and whatever the knowledge of Meghmala, okay, so and Saptapurni also joined here. So their knowledge is totally different from our clinical knowledge. So they are totally different. Their approaches is also different. They are well accepted in case of the legal proceedings. So for that reason, we are giving importance on this forensic psychology course. So thank you, Ruchika. Is there anyone who would like to share some ideas or something?
Professor, I'm Samim here.
Sure, sure.
Okay, sir. Now, do you have any plan to introduce the small, short course on this forensic? Because since I'm a qualitative researcher, really I would like to learn more on this. So, do you have any plan to introduce a course, a short course or something like that, which might be helpful for others to update their knowledge?
Yes, sir. Definitely. It's a very good idea.
Yeah.
Because we find a lot of the delinquents' behavior among the not only the children population, but also the adolescents, the college students also.
Yeah.
Recently, we observed something in Kolkata also. So it happens. Now,
Okay.
Particularly for the prevention aspect, so if we can do some study, some collaborative study between your university and RPRIT, because RPRIT is virtual, so there will be no problem. So I think it is possible. We can do some joint work in together. So there is no problem. There is no harm, nothing. And we are trying to, yes, today we are trying to select our faculties so that they can train the students of different states or different universities in this world. So because we have no geographical margin, nothing. It is totally internet based, and we are following the virtual system. So there will be no problem. It is possible. Thank you, sir. Thank you. In educational psychology, in educational field also, the forensic psychology is very, very important. Yeah. Nicely you have pointed out. Thank you. So okay, Meghmala, thank you, sir. Thank you. Meghmala, so may we call Next one.
Yes, sir. So our next panelist is, I guess, Shoptapurni.
Yeah,
Hello,
Shoptapurni
am I audible?
Yes, you are audible.
Okay. Okay, let me introduce Shoptapurni to all first. Hello, I'm audible?
Yes, you are audible. Shoptapurni, you are audible.
No, I'm Shreyashi Sharma.
Oh, acha, Shreyashi, yes, Shreyashi, you are audible.
Good morning. Okay, so now we are welcoming Ms. Shoptapurni Mojumdar. She is pursuing Masters in Criminology with specialization in Forensic Psychology from National Forensic Sciences University. And today she will discuss questionnaire used in forensic psychology. So we will be pleased, Shoptapurni, if you share your views, your idea. Okay, over to you. Yes, ma'am. Thank you, ma'am, for that introduction.
So one thing I like to share, that is Shreyashi Sharma. She is the academic assistant of our very important course, that is a telemental health counseling. So we are giving importance, that is a distance education, and Shreyashi Sharma is the academic assistant of telemental health counseling. Thank you, Shreyashi, for introducing Shoptapurni. Now, Shoptapurni, you can start now.
Yes, sir. So I share my screen.
Sure, you can share your screen.
Is my screen visible?
Yeah.
So just a minute. Okay, so a very good morning to all the professors and panel members present here. My name is Shoptapurni Majumdar, and I'm currently pursuing my master's in criminology with specialization in forensic psychology from NFSU Gandhinagar. And the title of my presentation today is a review of polygraph interview techniques, types of questions, and test constructions. So, in my presentation, I'll basically be talking about the types of testing procedures, the pre-test and the post-test interviews, types of questions, and the polygraph questioning techniques. So before I start my presentation on polygraph techniques, I would like to give a very brief introduction about the field of forensic psychology and its application. So forensic psychology is the interface between psychology and law. Forensic psychology is the production of psychological knowledge and its application to civil and criminal justice system. Psychological tests and forensic psychological investigative techniques and instruments that we use, such as the layered voice analysis, LVA, polygraph, the brain electrical oscillation signature profiling that is known as BIOS profiling, narcoanalysis, etc., are used at many points in the investigation, prosecution, and punishment of a crime. One common application of psychological testing in the legal system is the determination of whether an accused person is psychologically fit to stand trial. Another most interesting assessment for a psychological or for a forensic psychological assessment is to establish the mens rea of a person, that is the guilty mind of a person in a case. So a person cannot be held responsible for a crime if he or she did not possess a guilty mind, that is mens rea, at the time of the criminal act that he or she committed. The practice of forensic psychology involves investigations, research studies, assessments, consultations, the design and implementation of treatment programs, and expert witness courtroom testimonies. Now, to start with my presentation, so I'll give a brief introduction of the instrument, that is polygraph, and one of the most widely used forensic psychological investigative techniques. So a polygraph is a device that measures and records several physiological indicators such as blood pressure, pulse, respiration, and skin conductivity, while a person is asked and answers a series of questions. The underlying theory of the polygraph is that when a person lies, they get measurably nervous about lying. The heartbeat increases, the blood pressure goes up, the breathing rhythm changes, and precipitation increases. So a baseline for these physiological characteristics is established by asking the subject question whose answer the investigator already knows, and the deviation from the baseline is taken as a sign of deception or a sign of lying. Now, I would like to discuss in very brief the psychophysiological responses or the science behind polygraph. So the nervous control of the human body includes the central nervous system, that is the brain and the spinal cord, and the autonomic nervous system, that is the sympathetic and the parasympathetic system. The central nervous system primarily controls the motor and sensory functions that occur at or above a threshold level. It may be voluntary. The autonomic nervous system acts as a self-regulating system, autonomic response system of the body. The autonomic nervous system is composed of two complementary branches, that is the sympathetic and the parasympathetic nervous system, and they both act opposite to each other. So the fibers of both the organs where self-regulation is essential, when a person is under the influence of physical or emotional exertion like anger, excitement, fear, etc., like any physical or emotional stimuli, the sympathetic nervous system will dominate and override the parasympathetic nervous system. Thus, there will be a change in the heart rate, pulse rate, blood pressure, respiratory tracing, the galvanic response or the galvanic reflexes, the time of the response to the question, and also in the voice of the person. So the parasympathetic nervous system works to restore things to normal when the condition of stress has been removed. So it is the dominant branch where the condition is normal and the subject is calm, contented, and relaxed. The recording of some of the psychophysiological reaction of a subject when he or she is subjected to a series of questions and the scientific interpretation by trained expert are the basis of a polygraph test. Now coming to the components of a polygraph. So this is a visual representation of how the polygraph instrument looks like. The polygraph instrument usually measures 4 to 5 physiological reactions recorded by 3 to 4 different medical instruments that are combined in one machine. So older polygraph machines were equipped with long strips of paper that moved beneath pens and recorded the various physiological responses that like as in the charts where the charts used to be in the form of a chemograph that is no longer used in the modern polygraphs. So the newer equipments use transducers to convert the information to digital signals that can be stored on computers and analyzed using sophisticated mathematical algorithms. So the different components of the polygraph are, first is the cardiosismograph. So blood pressure and heart rate are measured using the cardiosismograph component of the polygraph, which consists of a blood pressure cuff that is wrapped around the subject's arm, preferably the right arm. During the questioning, the cuff remains inflated. The movement of blood through the subject's veins generate a sound that is transmitted through the air in the cuff to a bellows that amplifies the sound. The magnitude of the sound relates to the blood pressure and the frequency of the change in the sound related to the heart rate. Now the second component is the pneumograph component. So the pneumograph component of the polygraph records the subject's respiration, that is breathing. One tube is placed around the subject's chest and the second is placed around his or her abdomen. So these tubes are filled with air. When the subjects breathe, the changes in the air pressure in the tubes are recorded on the polygraph. The third is the galvanograph. So the galvanograph section of the polygraph records the amount of precipitation produced, that is commonly known as GSR, the galvanic skin response. It consists of electrical sensors called galvanometers that are attached to the subject's fingers, left hand alternate fingers. The skin of the fingertips contains a very high density of sweat glands, making them a good location to measure precipitation. As the amount of sweating as the amount of sweat touching the galvanometers increases, the resistance of the electrical current measured decreases, and these changes are recorded by the polygraph. The fourth and the final instrument that is used is known as the P gauge, that is placed under the hips of the subject, and the subject is made to sit on a cushion shaped instrument which measures micro movement. Next, we come to the phases of polygraph examination. So a polygraph examination takes place in the following phases. First, there's a pretest interview. Then there's informed consent of the subject. Third is the question formulation. Fourth is the test administration. And fifth is post-test interview. So what happens in the pretest is that the basic information from the subject about his personal life, his medical history, and related to the crime are collected by the polygraph examiner or the forensic psychological expert. The information includes basic stuff like the person's name, address, information about family members, spouses, information about their financial liabilities, if they have taken any sort of loan, health issues or medical history, which is very important because a person with some, if the person is suffering from some severe form of mental illness, then it's not prescribed for the person to sit for the polygraph examination. And whether the person is under any medication. So if the person is under under the influence of any intoxicant substance or alcohol or any sort of drug, then it is not prescribed for the person to sit for the polygraph examination. And then a case history is collected from the person. So there are two versions of a story. One is the IO's version. So the IO will tell the officer brief the officer regarding the case, but then there will be a subject's version of the story which might be different from the IO's version. So the pretest interview is basically important for rapport building with the subjects. The subject has to be made comfortable with the testing procedure and with the examiner so that the subject can talk freely and can reveal information about the case. Second is the informed consent. Informed consent is taken in India. It is usually taken beforehand in front of a magistrate. But even before administering the test in a lab like the forensic science laboratories, the subject's consent is taken. And then based on the information that the officer has received regarding the case, questions are formulated in polygraph. And then comes the test administration stage where the polygraph is actually administered on the person. And the final stage is the post-test interview, which is like the basic objectives of which are to clarify the findings or to learn if there are any other reasons for the subjects responding to a relevant question other than the knowledge of crime, or to obtain any additional information or any admission for law enforcement purposes if the results suggest deception. Now, this is a non-verbal cue about the subject. So this is used in most FSLs and CFSLs. This is a questionnaire where the scientific officers marks the responses after the usually after the suspect has left the room. So these suggest typical innocent and typical guilty characteristics of a subject. So whether the subject was friendly, whether he was giving direct answers, how was his eye contact, whether the subject was relaxed, composed, whether he was talkative, or the typical guilty characteristics, whether he was not very cooperative with the officer, whether he was giving evasive answers, whether he had any nervous body movements or nervous facial expression. All of that is recorded by the polygraph examiner.
Now I'll talk about the types of questions that are there in a polygraph test. So there are basically three types of questions: the irrelevant questions, the relevant questions, and the control questions. So the irrelevant questions are questions which have no bearing to the case under investigation. The question may refer to the subject's age, educational attainment, marital status, citizenship, etc. The examiner asks these type of questions to ascertain the subject's normal pattern of response by eliminating the feeling of apprehension. Second type of questions are relevant questions. These questions are directly pertaining to the issue under investigation. So they must be unambiguous, unequivocal, and understandable to the subject. They must be related to one issue or one criminal act that is under investigation. It is equally important to limit the number of relevant questions to avoid discomfort to the subject. So when a polygraph exam, polygraph questionnaire is usually designed, it's important to keep in mind that the number of relevant questions are not more than 4 to 5 in a set of questionnaire. Now, the last is control questions. So these are questions which are unrelated to matter under investigation, but are of similar nature, although less serious as compared to those relevant questions. So I'll give you an example. So for example, if the case at hand is regarding a robbery, so a control question would be, have you ever stolen anything in your life? So the examiner is not asking the subject directly if he is involved in a robbery, but as a general question, whether he has ever stolen anything in his life. So that would be a control question. Now, due to the time constraints, I could only focus on 3 of the mostly used polygraph questioning techniques. So I'll be talking about them in detail. The modified general question test, that is the MGQT, the peak of tension test, that is also known as the the known solution or the probing peak of tension test, and the stimulation test or CART test. So starting with the modified general question test, it is also known as the Reed comparison question test. And it was one of the earliest forms of comparison question test. It includes a probable like comparison question and is interpreted by the examiner's evaluation of charts combined with other observations made during the examination. So the US Army from 1953 modified the MGQT, that is modified general question test, in 1956. And it is the technique of preference in criminal investigation techniques where multiple issues are involved within a single case to be resolved. So it allows the examiner to address primary involvement, secondary involvement, guilty knowledge, and evidence connecting issues. In addition to being able to address multiple issues, examinees can be examined on the relevant question on one or more charts by collecting a mixed series of questions. So here is one of the examples of how an MGQT looks like. So the first question is usually an irrelevant question, like is your name Rakesh? The second question is also an irrelevant question, do you live in Delhi? The third question is a relevant question which has a mild association or primary involvement. So have you ever lied to the police? The fourth question is again an irrelevant question. The fifth question is a relevant question which has strong or direct involvement, like did you kill Ramesh for ransom? It's a very direct question that is being asked to the subject. Then the sixth question is a control question, like have you ever stolen anything? The seventh question is again irrelevant. The eighth and the ninth question are relevant to know the guilty knowledge. So did you kill Ramesh because you wanted to take revenge from his family, or are you involved in Ramesh's murder? These are direct questions that are posed to the subject. And the last question is again a controlled question, that is, have you lied during this test? The next test is the known solution and the probing peak of tension test. So the peak of tension test is similar in format to the concealed information test, that is another test used in polygraph to find out any hidden information. The peak of tension test is used.
Hello, Shaptaporni, please you unmute yourself.
Yes, sir. Am I audible?
Yeah.
Okay. So I was saying the peak of tension test, which is similar to another polygraph format, that is the concealed information test. But it is a bit different because questions are asked in a easily recognized order, and this is mostly used to find out any hidden information that is only known to the subject or the subject under examination. So a guilty examinee is expected to show a pattern of responsiveness that increases as the correct alternative approaches in the question sequence and decrease when the correct alternative has passed. So simulation tests also often have this format that I'm going to discuss in a bit. So in a known solution peak of tension test, the examiner knows which alternative is the only true connected, alternative connected to the incident, and evaluates the examinee's pattern of responses for evidence of involvement in the incident. It is also possible to use the peak of tension test in a searching mode when the examiner does not know which answer is connected to the event but wants to use the test for help in an investigation. It is assumed that the pattern of a guilty person's automatic response will reveal the correct answer. So for example, if we want to know if the amount stolen in a robbery, if you want to know the amount that was stolen in a robbery, so the question can be, do you know if the amount stolen was rupees 3 lakhs? Was the amount stolen 4 lakhs? Was the amount stolen 5 lakhs? And was the amount stolen 6 lakhs? So as the correct alternative, which is the amount, for example, if the amount stolen was 5 lakhs, so as this alternative approaches, the physiological response of the person will reach a peak, and then when this alternative has passed, the peak will come down. So so that is how the graph will look like. Then finally we have the stimulation test or the CART test. So polygraph examiners typically conduct what is known as a stimulation or a STIM test designed to further convince the subject of the accuracy of a polygraph examination. So although it is not actually part of the pretest, the stimulation test can be given either before the first actual set of the question or after the first chart has been recorded. So stimulation tests are intended to reassure the truthful subject and provoke anxiety in deceptive subjects. So their effect should be to increase the differential responsivity of deceptive and non-deceptive subjects to different questions on the examination. Some research suggests that the stimulation test increases the validity of the polygraph examination. So the most common STIM test is a number or a card test, where a subject is instructed to select from a deck a card that has a number or a word on the back, or to write a number within a certain range. So sometimes the cards are secretly marked or otherwise arranged so that the examiner is sure to know the correct answer. The examiner then may repeat a range of suits, numbers, or set of words in different orders, asking the subjects if each is the concealed item. The number or word that is actually the concealed item is supposed to provoke the greatest physiological response. So often the examiner will show the subject the polygraph to further convince the subject of the accuracy of the instrument. So this was all about the different tests, and I would like to end my presentation here. Thank you.
Thank you, Shaptaporni. When I was in post-graduation, at that time, I regularly attended the polygraph, and one polygraph instrument was there in the Department of Psychology, University of Calcutta. and Professor Prabal Kumar Chattopadhyay is a very famous clinical psychologist in India. He did a lot of the experiments on the polygraph. At that time, we have no idea about the forensic psychology. So thank you, Saptaparni. In case of the polygraph, what you have mentioned, we are trying to study the inconsistency or the consistency pattern. Am I right? In the physiological response. Am I right?
Yes, sir.
So what statistics usually we are following for assessing the consistency and the inconsistency of the responses? Is there any particular statistics or it's theoretical?
Sir, when it comes to polygraph scoring, so we have different scoring methods that we usually use. So the Utah scoring scale is one of them, where it has like seven numbers on the scale from +3 to -3, and the responses are marked on that, and then it's added. So if the sum of all the answers is between +12 to -12, then the result is inconclusive. If it is more than +12, then that is taken as a sign of deception. And if it is less than -12, then it is taken as a sign of truthfulness.
So we are following the pre-test, post-test technique, right? So that is the ANOVA with repeated measurement like that. Is it true? Is it possible to do the ANOVA with repeated measurement, Saptaparni?
Yes, so the ANOVA can also be used like with any of the instruments. It is a statistical tool that is used for the analysis of variance, that can also be used. But I was talking about the polygraph scoring, that how the polygraph is usually scored.
Okay. No, my point that is a polygraph score across the different periods, because we are following the same thing, because a lot of the questions are there. So this is my perception. I have no idea. So you can
May
share.
I answer your question?
Yes, madam. I am waiting for your answer.
Yes. So I was keeping mum because I was observing their presentation. So I thought that I should answer at the end. But this is a very relevant question. And actually in polygraph, what we do is we ask only 12 to 15 questions. It cannot go beyond that. Maximum is 15. Now, those 15 questions is a combination of relevant as well as irrelevant questions. Now, relevant questions are those questions which are directly related to the crime scene and related investigation. Irrelevant questions are of two types: control and comparison based, where we give something which is not related to crime scene or which are general questions. So for example, have you ever lied in your entire life? This is a general question. But if I ask that whether you have cheated in this RPIT semester end examination, this is very specific and relevant question. So that way, out of those 15 questions, 5 to 6 questions are relevant one, and the remaining one are combination of control and irrelevant questions. Now, out of those 5 questions, a baseline is taken and the responses on those relevant questions on those 5 physiological parameters are being taken. Now, when we talk about the analysis part, the physiological activation shown by the person's body is shown in terms of graphs. Am I audible?
Yes, madam.
So those graphs are actually in terms of frequency and amplitude.
Okay.
So when the data we receive, that is in terms of amplitude and the frequency. So those frequency and amplitude based comparison is being done. And if there is any change from the baseline, then we say that, okay, the deception has been shown by the individual on relevant questions as compared to irrelevant questions. Now in ANOVA, what we need to do is we need to have pre and post test data. So that pre and post test data is actually our baseline and relevant questions data. So that data is very small because we are asking only 5 questions 3 times. So 5 into 3. So 5 into 3 baseline data, 5 into 3 this relevant question type data. So that amplitude frequency data is so small that ANOVA is quite impossible. Now, if we try to give same type of questions again after a certain duration of time, then the polygraph result become irrelevant because the questions which a person has already attempted 3 times, that gets registered to the person's memory, and the chances of getting manipulative data becomes more. So if we want to conduct polygraph again and again, in that case, it is one of the limitations, or we can say that same questions cannot be asked. We have to change the questions. And the moment we change the questions, the reliability and validity part of the polygraph is not there. So we focus, as a forensic expert, we focus more upon the sensitivity and specificity of the polygraph instrument rather than the reliability and validity of the questions. That's the change when we follow instruments as investigation techniques as compared to the psychological test, the regular psychological testing format.
Thank you, madam, because the sensitivity and specificity is very, very important. Madam, you have pointed out that one, that is good. And it is, it appears to me that is, this polygraph test provides some data visualization. So we can find out the amplitude and the graphical distribution. So we can compare the general type question and the deceptive type question. Maybe that will be the indicator. It appears to me. I have no idea.
Yes, sir. Yes, sir. You got it right, sir.
Thank you, madam. So Shaptapurni, you are talking about the card test. I cannot follow. It is card number 1.
Yes, sir.
So what is that card test? What is there
Okay.
in the card test?
Okay, so the card test is a type of stimulation test that is used in polygraph. For example, there are numbers between 1 to 10. So the subject is asked to select a number between 1 to 10. And for example, the subject has selected the number 7. So one by one, the polygraph examiner will ask and the subject will not reveal what card he has selected to the polygraph examiner. Now, the polygraph examiner will ask the subject one by one whether the card selected by the subject is card number 1, whether it was card number 2, 3, 4, like that till card number 10. And this process will be repeated 3 times. So after the 3rd time, the graphs will be taken out and the responses to all the questions will be compared. And it is seen that in question number 7, the subject will show the highest pattern of deception. By observing the graph, the examiner will be able to tell the subject that the card that you selected was number 7. So this is mostly done to ensure the subject about the validity or the sensitivity and specificity or like the validity of the instrument, because sometimes the subjects, what they think that they can easily fool the system or they can get away with it, but this card test is usually done to install their belief in the system. So the innocent subjects will feel that, okay, if I have not done a crime, I'll not get caught. But the guilty subject will come to know that polygraph is actually an efficient instrument, and if the crime that he has committed will be caught, as like the pattern of deception will be there on relevant questions. So that is the whole purpose of the card test.
Okay, still I am trying to understand, because in case of the, for example, in Rorschach card, we find that some pictures are there or something, but in the card test, what is there? I cannot understand what is the card test.
Okay, sir. So the card test is not only done with numbers. So, for example, I tell you to write your mother's name on a piece of paper, and then I also tell you to write names of like 7 to 8 other women those sort of names on a piece of paper, and then only you know what you have written on those papers, like what your mother's name actually is. Now I collect all the 8 cards from you, and then I ask you one by one, is your mother's name this, is your mother's name that. So at the end of the test, you will show a level of there'll be a high physiological response on the actual name, like on your actual mother's name, because you know that option is approaching and you know that option is there. So like where I am currently interning at CFSL CBI New Delhi, we have seen like the card test has been demonstrated to us, and it was done with us with like our mother's name, our pet's name, or with like a random number, and it has actually shown to be effective. The examiner could actually like tell what like the actual answer to the question was by reading the polygraph, the graph that was generated.
Okay, thank you. And now it is clear. Now it is clear. So how we can assess the sensitivity and specificity in case of the polygraph?
Sir, I'm not very sure of the answer, so I don't want to give a wrong answer. But
no,
I'm not sure.
Sensitivity and specificity. Madam is talking about the sensitivity and specificity in case of the polygraph test. Have you ever done it or not? No idea.
So I've done polygraph, but I'm not very aware of this. How?
Okay, so what is sensitivity and specificity? What is the difference, or is there any similarity between the two? Is it necessary to assess the sensitivity and specificity of any particular psychological test?
So the sensitivity is the ability of a test to correctly identify, like, for example, how many people actually have COVID. So a patient with a particular disease, and specificity is the ability to correctly identify people who do not have that disease. So people without COVID. So they are also known as true positives or true negatives. In my opinion, sensitivity and specificity is very important as to ascertain the validity of the results that any instrument gives out. So to know whether the results given out in a polygraph test is actually like what is the accuracy of that test. So to determine that, we usually do sensitivity and specificity.
Okay, thank you. In RPRIT, during any sort of course dissemination, we are giving importance on the 3 areas. Number 1 is the theory, number 2 is the method, and number 3 is the testing. Okay, so that is the first level. And the second level, basically the research orientation. So students are presenting some of the research proposal, and we are trying to generate some funds for the students so that the student can do the research. So that is our motto. This is the policy we are following. Okay, Shaptaparni. Whether Chandri has joined, Nigmala? Hello.
Let me check, sir.
Nigmala, Chandri has joined?
No, sir, I don't think so.
Oh. Okay. So dear audience, if you have any question to ask, anything about the methodology, theory aspect or something, anything to Ruchika and Shaptaparni. I think Chandri once upon joined and she missed. I do not know what happened. Megmala, can you knock at the group?
Yes, definitely, sir.
Ashma is in office, so for that reason she cannot join. Just now I received information from Anupama. So if we do not get any response from Chandri,
Sorry, sir. Hello?
hello Chandri, are you here?
No, sir, Ashma, I'm Ashma.
Okay, Ashma.
Sir, I'm really sorry. I am listening everything, but I couldn't reply or any contribute anything right now because I'm in office and suddenly got call from my senior that I need to come to office today. So I'm really sorry, sir.
Okay, thank you. At least you have mentioned your presence. That is important, so that everybody knows that is you are here. I am thinking that is Priya Kaushal. So dear delegates, if you have any question, you can ask. Professors are here and the panelists are here, so there will be no problem. We can talk about it. And okay, now I am presenting Priya Kaushal's. I do not know whether Priya Kaushal, she has sent her.
So I think Chandri is in the WhatsApp group also.
What happened? Chandri has sent.
Chandri is not in this WhatsApp group also.
Chandri is not in this WhatsApp group. Why not? Oh, she has left, no? Yesterday?
No, that is Nikita.
Acha, then sorry. So what is the must be very clear. So if you have the phone number, please you call Meghmala.
I do not have any contact numbers, sir, actually. Chandri. Let me just check so once.
Okay, now I am presenting Priya Kaushal. So I am presenting Priya Kaushal. She is saying something. Is it visible to all of you? Hello.
It is, yeah, it is.
She is Priya Kaushal. She is in train now. For that reason, she has sent.
Good morning. My name is Priya Kaushal and I am a student of MSc in Forensic Psychology. I'm in my final semester and I am working on a dissertation titled The Psychometric Evaluation of Psychopathic Personality Traits Scale by Boduzek in the Indian population, basically the criminal population, as a risk assessment tool. So my dissertation is revolving around adapting one of the foreign scales to Indian setting by translating it and to Hindi and see if the translation and if the scale can be used for our Indian for the Indian settings. Now, so I am already working in the field that of the topic that I took. So the topic that I wanted to present on was experimental designs. So experimental designs in forensic psychology, again, it does relate to the normal research methodology which is taught across various social sciences and is used otherwise under other types of sciences such as the natural sciences. but the kind of variables that we want to assess and the constructs that we want to study and the phenomena that we are talking about here can be a causal phenomena or it can be an exploratory study of a phenomena. All of this is bound by certain different contingencies which we will not find in pure sciences. So in pure sciences, there is really no human involvement. There is no categorization in terms of gender, in terms of age, in terms of employment scales or socioeconomic scales. However, we follow such categorization of the variables which are being studied in forensic psychology. So experimental design, before we ever want to study experimental design, it is very important to understand what is an experiment. So experiment is nothing but controlled manipulation, or rather manipulation of a variable under controlled conditions is what stands as an experiment. So there are certain keywords here. When we say controlled conditions, then it means that the investigator or the researcher has an absolute I would say in manipulating whatever, or rather controlling what influences can be used or can be allowed in the research, in the experiment, and what influences should be avoided when we want to study variables. Similarly, when we say manipulation of variables, now manipulation of variable basically indicates that apparently there is a group where the variable will be manipulated and then there should be a group where the variable should not be manipulated. So therefore indicating the presence of a control group or an experimental group. Experimental group is the one where we basically we want to operationalize the variable, or we want to you take the variable which we really want to study, which is basically the independent variable, and we want to manipulate it across various attributes that it shows. So for example, if you are talking about stress, we can vary stress in terms of its intensity. We can vary stress in terms of its kind, like what kind of stress are we talking about. Is it a physical stress, like properly putting pressure, or is it a mental stress? And if it is a mental stress, then what kind of a mental stress? Is it something related to parents, friends, families, what? So when we say manipulation of variables, we are really focusing on various attributes which can be manipulated. Now this manipulation combined with the idea to control the variable, rather to control the conditions in which we want to study the variable, all of this basically points to the idea of operationalizing the variable, that is how and what phenomena of this particular variable can be studied. So experimental designs are basically this. Now experimental design broadly categorizes into two parts. One is called the qualitative design and the quantitative design. Quantitative designs is like it is like inductive logic. So basically we in qualitative, what we do is we start gathering data which is proper numerical values, and obviously this data pertains to certain construct or certain phenomena which is in question, and that will be also evident in the hypothesis that is made, or the aim of the problem, or the object question, the research object that we have in mind. So we start gathering data, and then this data is used and calculated using various conditions which are preset using statistics, and then we arrive at a conclusion. Now this conclusion helps us understand that the phenomena or the claim that has been made, now this claim is a crude synonym of hypothesis. So whatever hypothesis that we have claimed, is that hypothesis even workable? Does it really make any sense? Is the hypothesis We should not use the word true or false. Reason being, true or false makes it sound very dichotomous in nature, that apparently nothing else exists. It can either be true or false. However, that's not true with hypothesis. Whenever we carry out hypothesis testing, we always find more information as to about the hypothesis. It's more than true and false. This is what I believe. So yes, so whenever we do whenever we run stats on our data collected, we arrive at a very I would say ingenuous, or I would say ingenious conclusion, where not only do we find if the hypothesis works or it doesn't work, but we also find if it works, then under what conditions. If it doesn't work, then for what conditions does it not work. If it works, then what is the probability of this hypothesis staying such way out of 100 times. So it's very informative in nature. And when we come to qualitative statistics is more like deductive logic, where we see certain phenomena which might, I wouldn't say it is exactly like deductive logic, but it is somewhat like deductive logic, where we have certain notions and certain ways of thinking, certain biases, certain stereotypes which are prevalent in the society, and then so that becomes sort of like your universal statement. And then once we see particulars, like we see premises, different premises which actually pertain to this universal statement, and then we say, oh, even she's suffering, or oh, even he's happy for certain thing, then we conclude, okay, so everything is like this. So basically qualitative sort of focuses on various experiences, not just experiences, but various notions, various forms of thinking, various ways of living which are prevalent across in the society, and then it uses or starts to operationalize or starts to quantify these experiences. And once it is able to quantify these experiences by constantly studying similar side of ethics comes in, it is limiting in nature. It does limit a lot of potential of research. However, since it is for the good, it has to be kept in mind that no other human being should be harmed. Ideas of autonomy and privacy should be paramount in conducting these researches. So, whereas it is definitely limiting, it plays a very, very important role in forensic psychology. I think this sort of briefly sums up what experimental designs are, what research is, and what kind of research are we talking about in forensic psychology. Last but not the least, forensic psychology research mainly deals with, like I said, issues of the law, criminal minds, criminality, causes of crime, theories of punishment, if these theories are even, if it makes sense or not, aspects of rehabilitation in the correction administrations, aspect of risk assessment analysis in correctional administration, aspect of what factors, if exist, will ensure or will likely result into crime, and what factors are like your protective factors which will make sure that crime is not committed or someone is not harmed, how victimization takes place. Such things are called as constructs. Such constructs are objectively studied using different operational variables, such as psychopathy is studied in a different way when we read about hairs conception of psychology as opposed to Borduzek's conception of psychology. Psychopathy. Similarly, when we talk about Dr. Patrick's TRI-PM, which is the triarchic measure of psychopathy, if we use that conceptualizes psychopathy differently as compared to the Callousness scale. So here one thing is very important, that one must know how you're conceptualizing or how you're operationalizing a variable, and on the basis of the operationalizing of the variable, we enter into a whole new different world where we can start from scratch. We can conduct exploratory studies to explore the different phenomena under this operational definition of the variable and many things. So this is what experiment looks like in forensic psychology. Thank you.
Okay, thank you, Priya. Kaushal, she presented her ideas about the experimental methods in forensic psychology. And I contacted Chandri, another panelist, and Chandri was busy with some activities in elsewhere. So Chandri, it's not possible for Chandri to join. So now we have completed all the discussion of the panelists. So now it is open for discussion. And after that, I will request only the academic assistants, academic course coordinator, and two professors, particularly Professor Priyanka Kakar Madam and Professor Ishita Chatterjee Madam, to be here for other discussion. And Saptapurni and Ruchika, please you be here. Okay. So if you have any question, you can ask. Otherwise, we will close it now. Thank you, Dr. Jirina Begum, for joining. Now there will be some private programs. So I am requesting, please close your hands for the prayer. Purnamada, Purnamidang, Purnamudachyate, Purnasya, Purnamadaya, Purnameva Vashishyate. Om Shanti, Shanti, Shanti. Thank you. I am requesting only Ruchika, Saptapurni, Madam Priyanka Kakar, Dr. Ishita Chatterjee, Meghmala, Priya, Ruchika. Okay. Please be here. Otherwise, everybody please leave. And Professor Shamin, now, thank you for joining. Please you email me rpri.edu@gmail.com, and we will start any sort of program if you are interested. The same thing for the USTM teachers and the USTM students also. If you have anything to share, you can share. Now there will be some private meeting. So I am requesting all of you, please you leave, except the name that I have mentioned. Only the academic assistants of the RPRIT and the distinguished professors, Professor Priyanka Kakar and Professor Ishita Chatterjee will be here. So Professor Shamim, now you can leave. Saptapurni, please be here. Ruchika, you will be here. I'm requesting all of you, so please accept the requested person. Other people can leave now. Toli and Juba, please you leave now. USTM students, please you leave now in Gulin.
I guess you can also, sir.
Meghmala, please you be here.
Yes, sir.
Ashish Devnath, Anish Devnath, USTM, please leave now.
So we can now end the live YouTube streaming.
Oh, sure. We have to stop the live. Yeah.